There's a well-known secret that's redefining longevity, health, and performance. Discover how this groundbreaking technology helps keep you at your physical best. So we're WellWaveNOW, and we want to welcome you to our show here. We're your portal for actionable wellness insights. Meet your empowerment team. That's Breck Rice, the healthcare disruptor, decoder of medication complexities, and a community and integrative wellness expert. There's Dr. Bob Levine, the renowned brain researcher and national leader in drug-free pain elimination. And I'm Tim Daniels, your wellness plan manager, builder of personalized wellness approaches as unique as you are to optimize your wellness. And I've got expertise in our topic today, which is pulsed electromagnetic field therapy. But together, we are your wellness catalysts, committed to elevating your health, enhancing your functionality, and optimizing your performance at every life stage. Our objective is to provide you with innovative strategies to boost your happiness and unlock your body's full potential for health. We're WellWaveNOW, where timeless wisdom lights your wellness path. So, as we mentioned, today's topic is we're going to dive into what I call the well-known secret in the wellness world, which is pulsed electromagnetic field therapy. It's one of the most versatile tools for enhancing your ability for and chances for longevity, health, and performance. It offers benefits that complements and enhances traditional methods, and some of its benefits range from boosting cellular energy, promoting regeneration, enhancing circulation, to supporting heart health and pain management. So you can see its impact is wide-ranging. We encourage everyone to make an informed decision about whether or not to bring PEMF into your lives, as it has the potential to transform that wellness journey for the better. And so that's what we want to do today, is help you start on the path to getting informed about PEMF to help you make that decision. So what is PEMF first, and why do I call it a well-known secret? So again, it's pulsed electromagnetic field therapy. And what it is, you can call it frequency medicine, energy medicine. It works at the body, in my opinion, is first electric, then it becomes chemical, then it becomes physical. So PEMF works right at the electrical level to stimulate processes in the body, from producing the nitric oxide to help with bone production to many other things, stimulate right at that to reinvigorate those, to bring those back to health. It works at that functional level. Now, why do I call it a well-known secret? Because we're not talking about something that's because we're not talking about something that's on test or trial. If you take a look at, there are precursors to it. You can go way back. Einstein, much more intelligent person than I am, who called magnetism the flip side of electricity. And we would talk about that. So then you go way back to the Romans using electronic eels to treat gout and arthritis and work there. But we're talking even in modern times, it's been out there. The Japanese started studying the effects of frequencies on the body around World War II. Then it spread to Russia. So you've got a long history of studying that, even in relatively modern times. NASA uses PEMF, their own form of PEMF, on the space station to help maintain that health of astronauts in space. PEMF was first approved by the FDA after work coming out of the Columbia University Medical School system, a guy named Dr. Andrew Bassett, who got it approved in the late 70s or early 70s to speed the healing of bone fractures that weren't responding to other types of treatment. I looked, Breck and Bob, I looked a couple of months back when I was doing someone else's podcast on pubmed.gov and did a search on PEMF, and I came back with 839 returns on that. I updated that today just for fun, and there are now 899, like 90 pages, 899 returns. Now, did I go through each one of those and make sure there wasn't an error and return a false return? No, but even if you knock out 10%, you're still at 800 returns there on that. So if you look at PEMF, and pubmed.gov, for those who aren't familiar with it, is a trusted, maintained by the National Institute of Health. It's a trusted source used by physicians where they're looking for the latest reports and abstract on what's effective, what's new, and it's a source of double-blind, peer-reviewed, placebo-controlled abstracts and studies, so where the gold standards are. So you can find out there. So PEMF, widely studied, widely used, widely proven. If one goes out to YouTube or other sources and puts in PEMF, you'll see all kinds of personal testimonials come back. So you've got underlying science is good. One of the most studied things and research things out there. Yet, when I started working in this field over 7 years ago, less than 5, I would say this is subjective analysis and sampling, but less than 10%, less than 5% at that point in time, I think, of the general physicians and other practitioners heard about it, and less than 3% of the public had heard about it. And now I think maybe I would say it's 10% of practitioners and 5% of the general public. And then you've got also, in addition to what I went through, you've got teams like the San Francisco 49ers, the Arizona Diamondbacks, many of the European soccer teams, many individual athletes that are using PEMF. So widespread usage, underlying studies, good science, NASA using it, a number of hospitals around the country around the world using it, but so few people have heard about it. So that's why I call it the well-known secret out there on that one. Okay.
And Tim, can you say something about how the astronauts might be using it and why it would help them? Because it's kind of interesting. It's very different from being off the planet.
Yeah, so part of, and that's why also PEMF is natural. It kind of replicates frequencies that come from the Earth, and you get into it and stimulate what we need and get from that interaction. So what do the astronauts use or lose or have challenges with when they get away from the Earth's environment? Muscle loss is known. Bone density slows down. Overall circulation slows down. All these driving a lot of problems. What I didn't realize until I started taking a look at this is also astronauts sometimes getting away from the Earth's environment and interaction, their eyesight changes. They might go up with 20/20 and come back with a different eyesight. And sometimes that doesn't reverse back. So NASA came up with their own PEMF to try and help alleviate those and reduce those amount of problems that astronauts run into, Bob.
Great. Thanks for saying that, Tom. When you said their own PEMF, I gather you're referring to the fact that there are many PEMF devices out there, right?
Correct. Well, PEMF in general, if we want to go a little technical, I think there are many PEMF devices. There are many signals out there. It's a signal, it's a frequency, and there's three or four types of signal that can fall into the PEMF world. It's a trapezoid signal, sinusoid signal, a square signal, and there's a fourth one. So PEMF, it comes into any of those signals and any type of intensity, it can be defined as PEMF. And that's why as we go on, as you study PEMF and decide what to bring into your life, it is good to understand those and good to understand what of those have been studied and what the impacts of those various ones, so that you're getting something that's real and something that's really going to help you in a wide range of things. Okay.
Well, let's go ahead.
Yeah, let's talk real quick about the obscurity of this, because there are so many professional athletes that now use it. It's kind of their secret recovery, and so now making it more available or widely available to patients. That's where you and I originally connected, Tim, is when we were launching the Brim wellness centers here. We were focusing on bringing in the latest and greatest technology to help patients really get better, right? We're focusing on the outcomes and wellness rather than just taking care of sick patients. So that's how we got connected originally. But why has that been so obscure, and why isn't it more in the mainstream, especially when you have over 2,000 professional athletes that brag about its benefits, and you've got big name teams like the 49ers and the Diamondbacks here in Arizona using it?
Right, and some of the names that people can verify if they go and look at it. Phil Mickelson, it's been a number of years back when he had gone without winning the tournament. I think it was in 5 years, but made his comeback. He sent out I believe it was a tweet at the time where he said, look, this is what I'm using, and credited for part of his comeback on that. There's a dunk. I always want to call this. I always have to catch myself on this particular individual, because I used to bake a lot with my mother, and we always used to. Sometimes we'd do things from scratch, but sometimes we'd use Duncan Hines. But this guy's name is Duncan Keith, and those who are big hockey fans will recognize that name. Where I think he had three Stanley Cup wins on that one, and there was a Forbes article where he talked about his use in there. So very, very big names, very prominent ones. Why? Breck, I used to spend a lot of time wondering why it was so little. Why, to your point, why it wasn't as well known, as broadly used as it should be. I've kind of stopped on that one, because I've just taken it to once I now have the proof that it works, once I know and I've seen it work, the proof from the studies, the proof from interacting with people. When I spend a lot of time getting into the hands of MDs and others, and they often, once they let me in the door, would give me their toughest cases to say, fine, ranging from things with fibromyalgia to chronic regional pain syndrome to progressive MS, and seeing those things being helped with. I just kind of switched to, my mission is, regardless of the challenges of why it's not as well utilized and as well known as it should be, is to get it there. And so that's what And in this political season, you know how they change the narrative? I just changed the narrative on you, Breck.
I understand. I understand. So, you know, it's for
But,
those
but,
that,
but
that
before we go
joined
off
today.
those,
Oh, go ahead.
before we go off those questions, just as you talked about, and Bob mentioned earlier, you know, we've all kind of had our personal experiences on PEMF. I'd love for you to kind of, you and Bob to kind of share those personal experiences, if you would.
Yeah, age before beauty, Bob. He's fixing his hair. You look so beautiful. You're on mute though, my friend. So we can't hear you
I
anyway.
was wondering if you said beauty before age or age before beauty. I missed that, but anyway, I'll go. So, yeah, PEMF is remarkable when you talk to somebody who's had dramatic benefits, and I've talked to a lot of people that have had dramatic benefits. I want to just share two stories. One is my own, and one is someone else's. I went to and by the way, I like the mats, the various mats. We don't really talk about who makes what, but you know, I investigate mats when I look at the quality and I want to evaluate them. And I talked to one person who was diagnosed with a neurological condition where you shake a lot. You can, you know, that's a symptom. That's a symptom. And they used the PEMF mat for 9 months. And after 9 months, that symptomology was gone completely. And this person could run again, which they were barely walking before. Incredible result. And I talked to a lot of people who had similar dramatic results, getting out of wheelchairs, you know, and it's remarkable when you get with a group of people who know each other and they know the experiences over the course of several years. So, you know, it's not a bunch of nonsense that people are really getting these benefits. And in my case, I had what can only be described as lung congestion, like fluid in the lungs, and it would only show itself when I would lay down. I would lay down to go to sleep at night, and then when on exhale, I would hear this wheezing, like and I'm like, what is that? You know, and that was going on for like 10 years. And I saw a lot of physicians about it, and they all said, "Oh, that's normal. Everybody's got a little bit of that." And I'm thinking to myself, I don't think that's normal, and I don't think everybody's got a little bit of that. It just doesn't make any sense to me. Because when I sat up and I could do sports, and I was sitting up, and then nobody heard anything when they listened to my lungs. So but I got the PEMF mat that I liked at the time and bought and started using it. And I used it like as they recommend. It was like twice a day for somewhere around 8 minutes or 20 minutes or whatever you wanted to do, whatever I had time for. And what I noticed was that, and I wasn't after any particular result because I consider PEMF devices the ultimate one in the category of ultimate longevity devices, because when we talk about how they function with increasing microcirculation of all the modalities I'm trained in, I have no way of doing that really, except with the PEMF device. So that's why I was interested in like, what can it do? And what I noticed after using it for 2 months is that all of my congestion was gone, no more wheezing, nothing. And I'm pretty sure it's because the congestion in my lungs, when the small capillaries of my cardiovascular system were dilated, the flow of blood out of there was carrying all the fluid out, and then hence I was healed, and it was incredible. So it was just like, it's almost like that's where people get the idea that miracles happen, because how else can you explain it? But anyways, that's my
And on that point, Bob, that's it, as you talk about it, it is almost a miracle. It is a miracle to help people to understand that and not think that you know, that we push snake oil or patent medicine. The way I also like to add to that is a couple things. One, the miracle's not PEMF, the miracle's the human body. What PEMF does is give the human body what it needs to reinvigorate itself, to get back to a state of high performance. And part of the way it does, as you talked about, one is that microcirculation. But when you improve that microcirculation, I believe I had a debate with a doctor and one time as to how many other regulatory systems there are in the body. So I'm going to say there are at least 10 other regulatory systems in the body. But if you look at it, they're all dependent upon blood flow from one aspect or one degree or another. The endocrine system. I'm having a tough time pronouncing some words today. I better go get on my PEMF map before I continue with this one. But the endocrine system, the lymphatic system, all those are the immune system, especially the immune system. So when you enhance blood flow, the immune system is enhanced, the signaling is better, the white blood cells can get to where they need to get to better. Your lymphatic system, drainage improves. So you're really enabling, so there are effects that PEMF has on hormones and other parts, other things that happen in the body. But even that, just that impact of what it does from blood flow kicks up everything else because the systems resonate. If one's off, they'll damper the other. You get one up, they all perform better. So that impact in and of itself just has a dramatic effect on what the body can do to fight off things and to heal itself. But now, Breck, you've had some experiences yourself on the PEMF.
Yeah, I have, and my story starts with a scary drug fact, right? And that was that I was taking a maintenance medication for acid reflux, and didn't realize, even though I've worked with pharmacies for 20 years plus, but my doctor never told me this, that the medication I was on was actually leaching the calcium out of my bones, and was reducing my bone strength, or making my bones weaker. And so I found that out when on a ski trip, doing some snowboarding, and completely blew out my ankle. And so I had major surgery, plates, a bunch of metal or titanium put in there, and even a washer and a screw to put my malleolus, the bone of your ankle, back in place, because that had completely knocked off. And that whole surgical procedure left me with some numbness in that foot and ankle, and I'm sure there was some nerve damage there in everything that I did. So that was the initial reason for saying, okay, Tim, help me out on this. Let me, get me a device here so I can figure this out and see if this would work for me. And so I got on PEMF. But you told me all the other benefits of actually laying on the mat twice a day, in the morning and in the afternoon. Well, I didn't have anything other than that trying to get the neuropathy back in that ankle. I didn't have anything else debilitating. I didn't have anything like, Dr. Bob has mentioned earlier, but I have struggled with restless leg syndrome for a long time. For as long as I can remember, I always had really twitchy legs, and it seems like it gets worse as I was getting older. And I had it so bad that I was just rubbing my feet together all the time, trying to get some comfort to fall asleep at night. Within about a week and a half, I saw that completely go away, and hasn't come back. So wow, resolving a syndrome, restless leg syndrome, RLS, in a very quick time, in less than 2 weeks, was so amazing. That was even more amazing effect than the ankle, which took a lot longer, but has that feeling has completely come back. But it's taken a lot longer than the instantaneous response I got to the restless leg syndrome.
Yeah. And then so those two, and then plus for myself, I got into it, when I was leaving the home care business, which I got satisfaction out of, but I realized that was a help people cope business, and I really wanted to see people get better. And I knew, and I was taking care of people typically from age 79 up to 90, most of them were 85, but I still felt even at that age there were ways people could get better, and that search is what led me to PEMF and helped in that. So I got into it from that business standpoint of helping people. I do things now both on that direct consumer basis and also with providers, as I mentioned. But I decided, since I've got one of these myself, I actually have multiple ones, that I might as well, use it on myself and see what happens. I had some things, and I'm an old collegiate wrestler with some ripped up knees, and over the year arthritis set in. And first thing that I noticed, it broke up scar tissues, it broke up muscle knots, improved my range of motion by 50% in that knee. And also had some impact on me. I won't take you through why. This has been like 7+ years ago now. I was having some memory challenges, and it actually brought back my short-term memory and longer-term memory, and helped me with that, and it's continued to maintain it today. So there are a number of benefits that that I've seen on it. And, I will say one of the mental challenges I was having, I used to be a person when I was younger, Bob's age when I was younger, and I could work till 1 o'clock in the morning and get back up at 6 and do that for ages and not be, and still be highly functioning. I had gotten to the point where at 7 or 8 o'clock at night, I was done, and mine just wasn't functioning, slowed down. And that was the first thing I actually noticed. We haven't talked about that much. It was just about a week of usage was the mental pickup. It was 10:30 at night. I'm still up there, still sharp. I'm back to working. I said, wow, this is fantastic. And so it's been a big boon in addition to being good for others and help me in that service. It's been very good for me personally as well.
Yeah, that's excellent. Some folks may have tuned in because they thought they were going to get some additional information on heart health and cardiovascular, which fits in perfectly, right? Because that's probably one of the number one benefits from PEMF. Explain how PEMF can benefit your cardiovascular wellness.
Sure. So what you've got there, one of the things is inflammation in the body. And through a couple of mechanisms, PEMF helps reduce inflammation in the body. So that affects the heart. The heart itself is just another muscle. And when you can get more oxygen to its cells, as what PEMF does through that improvement of the flow, that improves the strength of the heart there. And then also what I've seen in some case studies. So not the gold standard studies you find up on pubmed.gov, but through some physicians that are very good, very knowledgeable, very well respected, who've done kind of their own case studies and articles when I worked with. This one individual, she was able to show that in 6 to 8 weeks of use, she was actually seeing changes in the number of blood markers. So A1C levels down, because diabetes is one of the key things that triggers heart problems. So she saw A1C levels down, spot glucose levels down, other factors markers that your physicians look for. So triglycerides, homocysteine. She saw all those down. So something was happening through the use, and she had tracked some of these patients for 20, 25 years, had been with them, and she had tried a number of different things. So here's something that I'll also talk about. We often talk about what it needs to integrate this into your life. And Bob alluded to it, you alluded to it, and I alluded to it. You don't have to do much on this one. You just got to lay down and use it. So here now, just laying down, using something three times a week, she was seeing impact on all those markers that are shown, that affect the degree and intensity or you're leading to cardiovascular disease. So it's big.
That's the best thing about the device, is that it doesn't require an exertion of energy. It's actually quite relaxing. Right. And when I use it, I listen to guided meditation audio tracks while I'm on there, and it's wonderful just to lay back, relax, and enjoy, and get all the benefits.
Yeah, that's my favorite exercise too, is laying down, right? And it works. I mean, that's an incredible thing. So for people that are really quite new to PEMF, we talked about the benefits on the cellular level. Explain that a little more in detail.
Well, what you get with PEMF, right? One of the keys, part of it starts at blood flow, what Bob was mentioning earlier, part of it. When you improve that, and improved blood flow not only can help at the large vessel level, the arteries and veins, but it also works at that capillary level, which is the last amount of the cells. If those aren't working properly, or those are decreasing for whatever age, disease, or other things, you're really hampering yourself. So one of the things that PEMF does is improve that blood flow at the capillary level. Once you start doing that, you get better delivery of oxygen to the cells. You get better uptake of oxygen to the cells. That also kicks up something called adenosine triphosphate. You see people running around taking all kinds of supplementations, ATP supplementations, but it's the basic unit of energy in the mitochondria to get the cells working. So that gets up dramatically. So now the cells function better. Better cells lead to better tissues, that lead to better organs. So in a wide range of things, it helps do that, Bert.
Yeah, that's great. And you talked about, we've already covered heart health and that, the circulatory system, which, our cardiologists can only help with a very small percentage of that. The majority, 74% of your entire circulatory system are the small vessels, are the capillaries and the small vessels that our cardiologists can't help us with. And so PEMF is getting to that level and is it because of the frequency that it can penetrate that deep, or what's the science behind that?
Well, the different frequencies do trigger off different things in the body, and one of the things that and so there's a frequency that kick off nitric oxide blood. There's Lewis. I'm getting the nitric oxide. If people ever get bored, if they don't know them already, they should go read about a guy named Dr. Louis Ignarro, who won a Nobel Prize around all the effects of nitric oxide in the body. We've got a question from a participant I want to answer a little bit. She's asked about a specific product. We're not going to talk about specific products on this one because we're not going to make any product claims for anyone. But to the part about when we talk about nitric oxide production and blood flow production, all true PMF will do that to some degree. Some may do it better than others, but all true PMF will improve that blood flow to some degree. So, but let's back to that. So, how to do that? So, Gnarl, who won the Nobel Prize, would show that the effects of nitric oxide helps with signaling, for example. It helps with memory. This is why some of these what I call the side benefits come up from use of PMF. However, what it will do, nitric oxide is also the way the blood flows through the capillary levels. So that frequency that helps and activation that helps kick off that nitric oxide production helps with that blood flow at the capillary level, Breck. But then we talked about that. Other things, just want to mention here, other things that the benefits of PEMF are not limited to just activating that nitric oxide production. It's been shown, like with Andrew Bassett, Dr. Andrew Bassett, of actually helping at bone production. All three parts of the bone production, the osteoclast to clear out old bones, osteoblast to build new ones, as well as another key part is the modulation. Make sure you've got the right amount going on that. PEMF helps with that. So that's where people will have osteopenia, people that have also progressed to osteoporosis. And I've actually worked with a number of people who have had that osteoporosis to the point where bone fractures weren't healing. A number of women at that point will break that fifth metatarsal bone in the foot. Last one I worked with, she had not shown any healing over 8 weeks, and used the PEMF and went back to getting scheduled for surgery. She went back to the surgeon. Surgeon X-rayed it, did some manual manipulation, and said, it's healed.
Yeah, that's amazing. That's why one of the reasons why so many athletes use it, right, is that accelerating of the healing. Think about the sport that Dr. Bob was involved in college, playing D1 football. He was slamming into people were slamming into him. You're getting these little micro fractures that may not be a break that will show up underneath X-ray, but enough of those little microfractures start to break down the body, and man, you need a recovery time for that.
Yep, I think Bob wants to comment, but I'm gonna pre-comment on this one. I found out, Bob always is this. Maybe he's changed over the years, but he's always this nice guy, and so giving and receiving and nice. And I found out I think he was a safety. And those safeties are the ones that really go around just
vicious
people on the vicious people. So yeah. we now know where Bob is really at.
I was a vicious hitter back in those days. I was known for
flying
that.
Around like a chicken with its head cut off. I know.
Yeah. So all I wanted to say was I wanted to mention detoxification too, because we all know how important detoxification is. And when you start, and also from a cancer perspective, we know that cancer cells are averse to a high oxygen environment. So I believe, and it's anecdotal, but I believe that the PEMF devices, the mats that people are using, can really help ward off, neutralize cancerous issues, and also in terms of promoting detoxification, eliminating toxins from the cells. The blood flow is the way to do it. That's the only way it happens, actually, or pretty much the only way. It's the major way. So the PEMF devices are so effective and powerful that I recommend anybody who's got unusual symptoms that cannot be identified by conventional medical care. Those are the people I want to see. And I always recommend a PEMF device of some sort, for them to use so that they can help with the symptoms that cannot be identified or cannot be characterized by a particular diagnostic code in conventional care.
Right. And to your point on, there are oncologists who use PEMF devices for a number of reasons. One, and I'm with you, the speculation that cancer has a tougher time existing in an oxygenated environment, and this does get the oxygenation up. Number two, there's also some view that some cancers feed off of sugars in the body, right? Our metabolic waste. That's to your detox point. It helps clear those out. Number three, others just use it as a way of when people are very heavy into chemo, that can damage the immune system. So they will often use PEMF as a way to help boost that immune system without giving them certain types of drugs, which I didn't realize that some of those drugs they give them can cause pain in and of themselves when they give them to kind of boost that immune system. So it is in use by oncologists for various reasons. So they find it some potential benefit in process in different ways.
Yeah. Before we leave the accelerating healing, there's a real interesting point, but we want to transition into, because there's so much more we want to cover here. I think I had a list of like 15 items. We've gotten to 2 so far. We might have to have a second time on this discussion, but just in even surgical points of entry, right, where somebody's having to go in and cut open the body somewhere to go in and make a repair and then close that back up. Imagine just having that much more blood flow to that incision, that much more oxygen to that incision, that much more nutrients to that incision area, or all of that area that just has been manipulated, how much faster that healing process is in getting that increase in what is it, vasomotion? Is that the proper terminology for that?
Yes.
What percent is increased on a typical PEMF?
It varies by devices, and again, I don't want to dive down into the specific devices. One because there are many out there, and that's one of the things that I personally can help people do, pick the right one for themselves, and we all can. But I don't really want to dive into, and plus the data trouble. You start pinpointing them. Some of them have made certain claims about percentages, and if we give the percentages, then people hearing this might know. We never know when the FDA is going to pick up that, and then the FDA saying you're making the product claims and shut us all down. But also, I'll just stay with the fact that any true PEMF, any good PEMF device will improve that vasomotion, will improve the blood flow there. But the other things that they do that also that helps, that oxygenation tissues helps our repair. But also the good PEMF devices will kick off some repair proteins, heat shock protein number 70, which speed the healing of that. And so there are a number of mechanisms that it does that it provides to help with that healing. And then in one case, and I've got wound centers that use the hyperbaric oxygen chambers, and they will put people on PEMF before they go in because they've opened up the system. Now the oxygenation can get down into there better, and it improves that. So that's why it's a beautiful primary approach in cases, and it's a beautiful secondary or adjunctive therapy in a lot in cases as well.
I think people want to keep in mind that all 3 of us share the opinion that PEMF devices are in the category of ultimate longevity devices. I mean, you want to live the longest, healthiest, and as Tim said, happiest life. It's really valuable to consider getting a PEMF device because it's with you for your lifetime. So you look to be 90, 100, 110, 120, 150. Some people shoot for 150. Me. It's with you for life. And so
I just you can shoot for it, Bob. I'm going to point you back to Genesis 6:3. Take a look at Genesis 6:3, and then come back and say, I
got to raise the number, I guess, huh?
We'll see.
Yeah, no, you got to go reread that. So, but let's get into a topic with PEMF that Dr. Bob is an expert at, and that's pain relief. So let's dive into a little bit more on that, and not just chronic pain, but think about some of the other things. Like, I guess this falls into chronic pain, is the arthritis, fibromyalgia. You're expert obviously at the lower back pain and other things like that. But PEMF and its anti-inflammatory benefits on pain.
When I work with people in my practice or over the internet or in person, depending on where they live, it's everything that's done by any practitioner, acupuncturist, chiropractor, massage therapist, physical therapist. It's all about increasing blood flow, energy flow, and nervous flow to the affected area. And so the nice thing about PEMF is that it supports everything that all these practitioners are doing. So especially if somebody's going to see a practitioner like once a week or something, and they get out of the practitioner's office, and after 2 days, they're back in their automatic patterns and they're suffering from pain again. Getting on a PEMF device can make that interval between visits to the practitioner really much bigger. So wouldn't it be great if you just had to go once a month for a tune-up here and there, as opposed to once every 2 or 3 or 4 days? I say yes for sure. And so that's why I like PEMF devices, because it makes my work, when somebody's got a PEMF device, it makes my work much easier, much faster, last longer. And so it's just generally a great thing.
Sure.
Yeah. I'll add to personal experience on it, if I can, real quick, Tim, is anytime that I start to feel any tightness in my lower back, whether I just slept wrong, it could be something as simple as that, or if I was moving those darn cases of water from Costco, not engaging my core like I'm supposed to, like Dr. Bob teaches us, right? But anytime I feel any of that tightness, I just strap on some PMF and literally melts away. That stiffness just melts away.
Yeah, it's beautiful.
Yeah, but that's part of the oxygenation of the tissues and other things. But a couple comments on a couple things Bob mentioned. I'll go back first to the longevity, where it's also the longevity one. And as you talked to earlier, Breck, a lot of athletes use, we've all talked, a lot of athletes used to it, and they came to it from the recovery. They often are attracted from the recovery standpoint. But if you think about what PEMF enables, it helps the athlete across the spectrum of what an athlete needs. Now I'll talk about spectrum, but that spectrum of what an athlete needs is the same thing that we need to improve our odds of longevity. What do you need? Better sleep. Dr. Bob's going to give us a thing on sleep here in a few weeks. So PEMF has been shown to help get that better rest and better sleep. What do you need? Effective medication or effective supplementation, like Armand took us through a couple times through. So what happens when you use PEMF? That better distribution of blood lets the supplementations, let the medication get to where they need to, and you also give the absorption rate with it. So whether it's from whether from the sleep, whether it's from the distribution and uptake of nutrients, whether it's being able to help you exercise better and recover better from exercise to do that, it helps that. And there are other parts of that spectrum, but it helps across getting inflammation down, and the inflammation down in the body, as we just talked about. So whether it's from inflammation, whether it's from rest, whether it's getting the most out of your nutrition, the most out of your medication, PMF is enabler of all of those on longevity standpoint, from that standpoint. And then on the pain portion, the comment on that is, again, think about what PMF is doing. It is starting to get you better functioning and better health right at the cellular level. So it is working as much as possible to address the root cause of that pain. There are times when your body's missing something that's been damaged so much that it's not going to magically help, but it is working as best as it can to address the root cause of that pain, and it'll trigger off the body's natural pain management functionality as well in there. So helps both angles.
Good. Tim, you're an expert at this. I'm going through my list here of the 15 or so items that I had, and you've touched on just about every one of them. Reducing blood clots, that was on my list. How does PMF help with reducing blood clots, or the risk of blood clots?
Well, it's been there's a debate on this. If you find, it depends on what it is. It depends on what type of blood clot you got. If it's the DVT, deep vein thrombosis. Right. There are some PMF devices that say you should not use it while you have an active DVT. Yet I will also articulate that there are places in Europe and other places that they say do use it then, because it will help break it up just from that blood flow and break up the clog. And it can also be used as a prophylactic. People will, if they're sitting on the airplane, they're not moving around. Sometimes a lot of people use a mat, or somebody use one of the mat ones, or some have attachments. Some of the mats have attachments, and use that to keep that blood circulating to prevent it. So on the first part of unclogging, there's a debate, and so I say, since we're in the U.S., I say be kind of cautious with that. But know that some people do, some countries do recommend using it for that. On the sort of prophylactic approach, I said, yeah, because when you're keeping that blood flowing and circulation, you're going to avoid you're going to reduce the chancing for clotting of that factor.
And also, when we talk about prophylaxis, you're talking about warding off all kinds of other conditions.
Right.
That's a beautiful thing. It's really about achieving optimal health and optimal balance in mind, body, spirit. The whole thing, the whole being can be balanced with this PEMF device. So it's very integral to that whole optimization of life in general.
Right. And so since we touched on that,
we always talk about.
Beautiful.
Since we talk about it in the wellness practice. Sorry, Tim.
Yeah.
So we talk about this in the wellness practice all the time, that you've got to control inflammation, right? Because out of the 45,000 or whatever, however many diseases that are known out there, and we find new ones all the time, but a big high percentage, like 90% of those, originate from some kind of inflammation. Right. And so being able to reduce that inflammation, we touched on that, and improving, nerve function. I covered that. What were you going to say, Tim? Sorry for talking
Oh,
over you.
it's quite all right. Yeah, we all have so much to say on this topic. We're all so much in love with it. We're just gotta do with it. We just gotta keep Dr. Bob from coming in to sack us, Get him
Yeah,
back.
I've been really good, Tim. I mean, you and I are on the same page with PMF, so it's working for us.
But you know what?
Yeah.
When I touched on the cautions that in some countries talk about using it when there's an active DVT or diagnosis of it, that brought to mind, where should people often say, hey, well, if this is so great and so safe, and it's safe, are there places that you shouldn't use this, and are there side effects? So number one, I think sort of a common acceptance now for where this should not be used is that people that have implanted devices that are active. So such as in Bob's world, where they've got that pain medication pump. If somebody's working with somebody's got a pain medication pump, they should not use PEMF because it could not be shown in some cases that the frequency would interfere with that and shut it down. I was working with one doctor, and she said that made sense because we have the same concern when people are put into MRIs, and they get that intense stuff that will sometimes shut down. It's supposed to restart, but why put somebody into that type of situation, especially when you're going to have them use something every day? You should stay away from that.
Yeah, I just want to mention, if I may, it doesn't make the PEMF, but I just people don't know necessarily that I put out a free program on the Great Discovery e-learning platform called How to Walk Your Way Out of Chronic Pain. So I put that link. If somebody wants to grab it, it's a great program. It can teach you how to walk properly and avoid a lot of difficulties. And I also put my contact information in there. And I'm sure Tim and Breck are going to do the same thing, either in the chat or in the show notes, right?
Sure. Yeah. Yeah. And so, so you've got that portion on there. Aside from that, there's not really, some countries will say you don't want to use it on infants, yet other countries use it in the incubators of premature babies. So that depends on what country guidelines you want to follow. But that's the main thing I think that almost all PEMF providers talk about and adhere to is don't use it when you've got something, an active, defibrillator. I think defibrillators fall into that realm, the pain medication pumps, and there are a few other things on that. Now, when it comes to pacemakers, that's also a debate in what country that you live in on that one. In the U.S., everybody kind of agrees. The FDA has kind of said, stay away from using PEMF as a pacemaker. Other countries will say, look, if just you work with your doctor, and if the doctor says it can tolerate these frequencies and it's been built correctly, meet the EU standards, then then it's okay.
The other way to do it is to go to the hospital and try it. You're in the hospital. Yeah.
Is that also the same depending on what country you're in for reducing migraines and headaches? Is that something that's kind of FDA is kind of frowned on here in the US, but it's widely used in Europe?
What I would say is that's the following. That's a kind of an off-label use. The FDA has. There are two in the low frequency PEMF that we're talking. There are high frequency PEMF, which I don't really like to have people use for a number of reasons. We'll go into maybe on another discussion. In the low frequency area of PEMF devices, and again, when I talked about where you don't use it, that's also getting a low frequency one. High frequency one's a whole other category. The FDA has not approved it. There are two brands the FDA has kind of approved at different levels, and you can find those brands and they will tell you what they've been cleared for on that stages. Migraine use, the FDA has not really cleared PEMF to say, hey, it cures migraines, it cures this, it cures that. That said, there are then studies, and that's where I point people to the pubmed.gov. Also go out to Google Scholar and do it, and you'll see that PEMF has been shown in other environments to be very effective on migraines, and that's regardless of country. On that one.
Okay. I only have one last thing. I know we're running short on time here, but we touched on it before, and then we probably should also thank our sponsor for this for today's program as well. But the enhancing the detoxification. So personal experience there. One of my board members is a addiction recovery physician, here in Phoenix, and was utilizing PEMF, having the patient literally hold the transmitter right directly over their liver to try to help with the flushing of toxins in that. Now, explain how that works, because it has something to do with the lymphatic drainage.
Well, I think if I recall on that, certainly the lymphatic drainage helps get things out of the system, and certainly getting things out of the cell. I think in that particular case, if I remember, we were chatting with that individual. They were talking about the fact that in the liver that opioids are processed differently by the liver. So therefore, if you could concentrate the use of the PMF right on that device, and I think he remembered it helped in two ways. All around the way that opioids work, and one was that liver functioning, so to be able to get it out of the liver, get liver functioning on that one, it could help break that portion. The second part, if I remember correctly with his discussion, is that part of what they would do to be able to they would go the whole process of getting people off the opioid, but it would also store a certain way in the fat. So when the fat would then burn off, they would just kind of reinvigorate the addiction. So he found that the PEMF could also get things out of the fat and so lessen that impact. So that's what he thought was very, very effective.
Yeah, that's correct. It was the synthetic fentanyl that was storing in the fat, and that's why there were so many problems, and there's still so many problems with overdosing, because when the fentanyl is stored, it's not in the bloodstream, and so they're not getting the high. The person takes more fentanyl to try to get that high, and then it can release out of the fatty tissue, and now they've overdosed. So real big problem with that specific drug.
Right. And I found, I have found people that, again, this is anecdotal. I haven't seen any studies on this, but there's a rationale behind it. I've seen people that and it did help me a little bit myself on it too. I used to be in Nebraska, and I used to dip tobacco. And I found when I started using the PMF, that craving for that, because I was reduced. So it was getting it out of my system. It was helping with the tissues. So it helped with that. I also found I've had a number of people asking, how does this help? This help with weight loss? And it does. And one, it helps speed up the metabolism over time. But number two, the same way. So food addiction is getting the sugar out, is getting the salt out of the system. It's also helping that distribution uptake of nutrients, so they feel more satiated from what they do eat. So, and all those, you asked for one addiction, I gave you 3 addictions.
There you go. There you go. Well, before we wrap up, I'll turn the time back over to you for the wrap up, Tim. But want to thank Better Alt for our sponsorship this hour. And according to independent studies and pubmed.gov, this supplement can improve your energy level, enhance your cognitive function, support healthy aging while boosting your immune system. So there's 102 main trace minerals that you should have in your body, and this replenishes like 85, 87 of them. And it's the pure Himalayan shilajit. I use the honey sticks because they taste better, but you can get those at Better Alt or thebetteralt.com, GNC, and other fine retailers. There's a special right now in the TikTok shop. You can get 20% off, and it's always free shipping if you get it from the TikTok shop. So back to you, Tim.
All right. Thank you, Breck. And so we barely touched the surface of on PMF today. There's so much you can dive into on any aspects, more on the inflammation, more on what it does for cardiovascular disease, and help that more it can do on autoimmune conditions, what it does for longevity. We could do a show on each one of those, but I do hope we achieve the objective today of giving people enough information to say that they should really look into this for themselves and make an informed decision, because of the impact this can help have on their health, their wellness, and their performance, and in Bob Levine's world, even their happiness, so that they can dive in deeper. And each one of us are happy to help them do so. So thank you for joining us. And indeed, as Breck mentioned, we'll get you the info. We'll get Mary Uter on here on her reversing heart disease, and we'll get that information to you and keep that promise in the future here.
Next week, Tim, who's on deck for next week?
Next week, we're joined by, I want to answer one question here in the chat here, respond to it, and I'll come right back.
Yeah, so I always like to give a little teaser to join us. This does happen every week. We do the live recording right now at this hour, 4 p.m. Eastern time, 1 Pacific. You can always join us live on Facebook, live on TikTok, and then the live Zoom room, which we're in now.
All right, great. And so next week we're going to have with us Dr. Jeffrey Zimmerman, who I've known now, I think, for a good 6-7 years. He is a doctor of Oriental medicine, but what he's going to be talking to us about is he's developed a thing called harmonetics, and he'll talk to us both, and it's focused on relieving PTSD, anxiety, and stress, and his method for doing that is a published author on it. You can find a book on harmonetics, I think, on Amazon, and he's now focused a lot on helping veterans in that regard. So that's a nonprofit. He does have a for-profit that will help people outside of that with the same type of technique. But he's going to take us through what harmonetics is, how it approaches, and how it's been delivering fantastic, rapid results and helping people with PTSD and other anxiety-related items.
Yeah, looking forward to that. Thanks for being here today. It's always a pleasure to be here with you. And thanks, Tim. I love this topic. Like I said, we didn't get near enough time on it. I could spend another 2 hours going through more of the details of what I've been able to learn from you over the last couple of years.